Really, it's a privilege to welcome you all to AAHPO's annual meeting. This is covering the year 2020. And as we go through 2020, we're going to take sneak peeks at the year upcoming in 2021, as we do have activities planned. For those of you that don't know AAHPO, this organization is led by a 34-word mission statement, which really dictates everything we do. That's proven to be very resilient in our 26-year history, and it's really provided a framework and a roadmap as we navigate through challenging waters, unknown waters, whatever challenges we face. It always comes back to our mission statement, and all of our programs are based on this mission statement. We're very grateful to our founders for doing something very innovative in 1994 when we were created. They created an organization that just wasn't medical doctors, just wasn't pharmacists, just wasn't nurses, just wasn't social workers, but really was a big tent and an inclusive tent, which was, hard to believe, very advanced for that time. When Ani's uncle, John, was in Boston, things were very separated, as they are to this day. But this is the source of our strength. This is the source of our resiliency, the success of our programming, that we have so many diverse opinions, and together we can make an exponential impact on healthcare delivery. Really, it's with gratitude that we have this meeting. We're very grateful to our board members who have worked so hard with so much energy and passion over such a long period of time. We're grateful to our new members who have joined us on this meeting and throughout the year. And many new people have joined us throughout the year in our activities, which was very heartwarming. We couldn't do what we do without our donors, to whom we're very grateful. They trust us to implement our programming and our mission, and we do everything we can to earn their gratitude and their respect. We also want to thank all of our collaborating organizations. We have never felt closer to all these nonprofit organizations as we do today, in large part due to COVID. We had cooperated with a lot of these and organizations in the past, but this last year, 2020, it was an incredible collaboration where we all worked together to save lives. This was a challenging year for many of us on so many different levels. Unfortunately, some of us did suffer personally or had relatives who suffered from COVID. They're all in our thoughts and prayers. As a board, we lost a very dear board member to lung cancer. He put up a valiant 7-year fight, which was really truly incredible after presenting with stage 4 cancer. But Rafi Hovanessian is somebody who we do all greatly miss, whose family is in our thoughts and in our prayers. And he really did put up a good fight, and he is with the Lord as we speak. We learned last night a lot about Rafi through his family at a dinner with his family. And we learned that one of his favorite quotes was a quote from Theodore Roosevelt: "To educate a man in mind and not in morals is to educate a menace to society." This was a quote he kept near and dear to his heart, and it really says a lot about the man. He was a very principled man who made righteous decisions based on the facts, on the evidence, without the political considerations that sometimes cloud the issue. He, did suffer some consequences along the way, but the testament to his success are the people that he helped, the institutions that have survived political turbulence. So we're very grateful for his example of being such a disciplined individual, really of unmatched sagacity. It's been said that he had a photographic memory. Many of us who knew him knew he was extremely well read, not only on current events, but on historical Armenian events, customs, culture, religion, the gamut. He was really a very wise and well-read individual, but so accessible. And there are many stories of people coming up to him in church, asking him for medical advice. And he never went to church without 2 pocketfuls of medicine. And he would dispense the medicines every time he went to church back home where he practiced. He was a trusted advisor. I know I personally had called him for advice regarding issues related to AAHPO and others. It wasn't only his friends that called upon him, but the Veripas through the years, the priests, the clergy, students, as well as patients, administrators, and political leaders. He was really tireless in his efforts. He always had welcoming words and a warm smile with a gravelly voice, and you knew he was present. You never really saw him looking tired or saying, I can't do it. He always followed through. He was a foundational pillar to many of the organizations he participated in. We were so blessed that he was part of AAHPO, but just as we saw his vigor and creativity impact our organization, he impacted many others as well, Armenian and non-Armenian. You couldn't do any of this or all of this without being passionate. He was passionate about everything from his family to the church, to his family, to his friends, and the organizations. A very gifted person who proved to be a mentor to many of us. How did he help AAHPO? Really, his contributions are countless. The first is the medical missions program. In 2005, we went to Armenia. We rented a bus. He made sure we went to village clinics, met in Yerevan with medical leaders, some of whom we speak to this day, including health ministers. He really paved the way for the medical mission program as we know of today, and we'll hear more of in a few minutes from Dr. Joyce Kurdian. He brought to us this concept of continuing medical education. Education was very, very important to him. And it was through his efforts that we founded the program in Artsakh, which we'll talk more about in a few minutes. The Armenian Heritage Cruise was an idea that he brought to us. He had a vast social and professional network, and he was the go-to person for so many people. And one of them was the Armenian Heritage Cruise, which came to Dr. Hovhannisyan and asked, how could we start a continuing medical education program on the Armenian Heritage Cruise, which we're going to hear more about in just a few moments. He had very strong and deep relationships with the clergy, which has really proven to be the bedrock of support for this organization and a way that we can communicate our healthcare message to the followers of the church. Many of the clergy we're friends with to this day, and in fact, this Thursday, we're going to be having a town hall featuring our relationship with the clergy. He was also a big believer in the power of what we can do when healthcare providers of all stripes work together. He was a huge proponent of the Armenian Medical International Committee, and rumor has it at one meeting when it was teetering and about to collapse, he pulled out his checkbook and wrote a check that ensured the organization would survive another year. And the organization really is thriving today because of his and others' action. It was under his guidance that AAHPO actually joined the Armenian Medical International Committee. And what he did is he whispered in our founder's ear, Koren Nalbandian, that we should host the 2009 Congress in New York, the Armenian World Congress, which we did, which then gave financial backing to AMIC, which then helped to become so impactful as it was during this last crisis that we've just been going through. When we think about all of his activities, his passion, his involvement with his family in the upper left, his involvement with our founders, his involvement with healthcare missions in the bottom right, and with leaders that we see in the bottom left, he really truly was an ambassador to medicine, but also to humanity, someone we are forever grateful. As we pay a tribute to Rafi Hovhannisyan, he joins the other pillars of our organization, many of whom have left their imprint on all the activities we do, beginning with Dr. Edgar Housepian, who truly was incredible, who actually performed the first medical mission on his own during the earthquake in 1988, and who helped found the organization Fund for Armenian Relief, who was a very strong collaborator with this organization. And Koren Nalbandian, a founder of this organization, who I was going to say single-handedly, but along with his wife Seta, really enabled this organization survive the first 10 challenges the first 10 years offered, and they were quite significant. And then Haigas Grigorian, who did many efforts to help Armenia in this organization. And when we mention all of these individuals, we should not forget their spouses, in particular Shohag Hovanessian, who's been very critical to our success. I'd like to introduce our next speaker, Dr. Arthur Kubikian, who was our vice president, is our vice president. He was elected in 2006. Rumor has it he's going to give his position to his children, who will take over as vice president. He's enabled AAHPO to endure and to thrive all these years. He is an esteemed Knight of Vartan. He co-chaired the April 24th Times Square Genocide Memorial Committee and currently is culminating a long career as a part-time teacher, now full-time, as clinical assistant professor of endodontics at New York University. Thank you so much for joining us, Dr. Kubikian.
Just a few short comments. As he mentioned, this year has been a year of challenges and crises. The COVID issue, the Armenia crisis, and loss of a valuable member, Dr. Rafi Ovanessian. I'd like to give you my perspective that AAHPO is an organization under the leadership of the president. A number of key members met these challenges with great know-how and energy. We cannot overlook the mobilization for helping the war effort, finding medical supplies, surgical instruments, small equipment, finding where to store them, finding means of transfer, and then being able to deliver it successfully to Armenia. So this was all possible because of the key connections of our president and some of our own key board members. The other item that cannot be overlooked is the fact that for the past 15 months, there were town halls organized by Dr. Najarian and key members of our boards. They were every 2 weeks on Thursday. They provided key information from experts on COVID-19 and Armenia crisis issues with key invitees in an era period of where many of us felt depressed. These meetings truly provided a sunlight in our thinking. At this time, I'd like to approach the organizational aspects of our meeting. And if I'm correct, we do have 70 members, and according to our bylaws, we should have a simple majority, which means that we should have 36 members present. Since we have 70 members and we have more than 7 members present, we consider today's meeting open for the transaction of business. And for the transaction of this business, we will need a temporary chairman who will also record this meeting as a secretary. And so at this time, we need your input. I would like to receive nominations for temporary chairman secretary for today's event. Are there any nominations at this time for a temporary chair secretary for this event?
I nominate Dr. Pierre Malgin, who was a member of the original board and helped create the founding documents of this organization.
Thank you. Are there any other nominations for that position at this time? None being, I would suggest that we accept this nomination, and with the approval by Dr. Maljan, then he becomes the temporary chairman recorder of this event. Dr. Maljan, are you there?
Thank you very much. It's always an honor to participate in the events of this great organization. Thank you.
Dr. Maljan, you are in charge. Thank you for your support.
Okay, so for our first order of business, we have elections, and we have a slate of 8 candidates and 8 open offices. So let me just read the slate of candidates that we have. We have Dr. Aram Kazazian, we have Lynn Satine, Dr. Deborah Fernman, Dr. Kim Hakimian, Gregory Kazanjian, Dr. Soline. Please forgive me, Soline, because I always have trouble with your last name, Kojaklanyan, We have Lina Merjanyan, and we have Lucy Tovmasyan. So this is the slate of 8 candidates that we have, and we have 8 offices. I guess, can I have a motion from the floor that we accept the slate of candidates by unanimous approval?
So move.
Can I have a second?
I so second.
And does everybody agree?
Yes.
Yes.
And is anyone opposed? All right, having no opposition, then we accept the slate of 8 candidates as having been elected to the new board of AAHPO. So congratulations to our candidates. So proceeding, the next order of business will be the annual reports for the meeting. So first on the agenda, we have a few words from Dr. Najarian. Larry, do you have a few words to say?
I'll make this part brief. Continuing medical education is very critical to our organization, and it's taken a number of forms. One are CME events that we've actually produced for CME credit here in the United States. Now we are supporting something called the ICPD. This is the International Center for Professional Development, which is providing continuing medical education to an audience of up to 1,000 worldwide, including Armenia. We supported and sponsored the first and now soon to be the second program that's going to be taking place shortly about rehabilitative medicine in Armenia.
Our next speaker to discuss CME is Dr. John Bilezikian.
Oh, thank you, Pierre, and thank you, Larry. I see on the agenda, I'm to discuss the Armenian Heritage Cruise and future plans. I think I'll limit myself to that, unless you want me to talk more. For many of you, the Armenian Heritage Cruise was kind of a mixed blessing. We were involved about, I don't even know how many years ago. It started through Columbia University, that has a very, very big CME program, not different from many large medical universities. And the opportunity to provide CME to the Armenian healthcare professionals on the cruise was the original intention. And we appreciated as well the opportunity to expand this. But let me thank some of you who worked with me. Larry, of course, was one of our faculty. Greg Kazanjian was our faculty. Rafi was involved. And I know Louise and Arthur were loyal attendees to those programs. Sam Badalian, who is in New York, he's actually now head of OBGYN at Mary Imogene Bassett Hospital, one of the Columbia affiliates. Sam was a regular faculty, and Vartui Petrosyan from AUA also came once. And it was very successful from the point of view of CME. It was not very successful from the point of view of attendees, despite great efforts on our part to have to improve attendance. And to be frank with this group, we had there were some tensions between us and the leadership of the Armenian Heritage Cruise. This is a group with a holding corporation that something like the Armenian Cultural Association. I don't think anyone has ever heard of this, but in any event, there were tensions about what we wanted to do. Let me give you one example. Larry and I spoke often about expanding the opportunities for CME, not just to the Armenians on the cruise. There were 5,000 non-Armenians on the cruise, and we hope to be able to open that up in part to introduce these other individuals to AAHPO and to Armenia. Unfortunately, the leadership of the AHC didn't go along with it. Well, let me bring you up to date. There was no Armenian Heritage Cruise, obviously, in 2021. And for 2022, there won't be a cruise either, because the brain trust of this group has decided rather to make a long weekend of fun and surfing in Punta Cana in the Dominican Republic. It will be like a 4 or 5 day weekend, and that really isn't conducive, in my opinion, to a CME program. So I really don't see a future for AHC with regard to what we want to do. I would like to think, and maybe this isn't the time, Larry, to get into this in detail because there's a huge agenda before us. But Colombia is planning, because it already does cruises independent of AHC. And I've spoken with Kim Snyder, who's our CME person, and we haven't gone much farther but to discuss how we could perhaps have an independent cruise, do it ourselves. I think we could be much more successful in every way. We could market it better, we could fundraise better, we could teach better. And again, we could have this a more broad-based initiative, obviously centered on Armenia. But again, we're recognizing that most of the 8 billion people in the world are not Armenian. And let's reach out to some of them. So anyway, that's my small report, and I'd like any feedback either now or later about how we could go about going on our own. Of course, we would do it with Colombia, but not with the AHC.
Yeah, that's wonderful, John, and we applaud all of your efforts. It's not easy to produce a CME course. There's lots of paperwork and expense, and I think we all appreciate the many years that you helped make this a successful program. In terms of the concept of working and joining Colombia, it's a wonderful idea. I think many of us have worn blinders in the past and think that only Armenians can help Armenia. But when we look at the traits of successful mission programs to other countries, when we look at successful efforts in Armenia, whether it be the eye care project or the osteoporosis project, one should never underestimate the contributions of non-Armenians. So I think we'd be very happy to explore this venue. In terms of other venues, there's been talk between Washington and Boston and organizations in between on the East Coast, Philadelphia, to do something together. And there is a precedent for this. We did have a meeting in Atlantic City that was somewhat successful. We did it in conjunction with the Armenian Bar, which needed continuing legal education credits. So there's plenty of opportunities here. And yes, this isn't the right forum, but we appreciate your restless mind in exploring for new opportunities to move this forward. Thank you so much.
So next on the agenda, Lawrence, Larry, we also have you to speak about the CME and fundraising program for October 17th.
The CME program is one of our longest acting programs and really very successful as an organization. We've invested over $500,000 into this program, and it has been really achieved its goal. Prior to the war, we trained over 230 healthcare providers, mostly physicians, from both the capital city of Stepanakert as well as the rural areas. Physicians, some of them have taken the course 2, 3, and 4 times. This course has historically been and continues to be is we take healthcare providers, we identify critical skills that they need. So for example, if they're an obstetrician and don't know how to do a C-section, if they're a cardiologist and don't know how to do a heart procedure, they're a pulmonologist and don't know how to treat an asthma attack. We find a mentor in Yerevan who are specially trained in Vienna and other places. And we provide this student with housing, a stipend to cover their lost salary, and food, and provide them a 1-month-long internship with this mentor. In addition, a critical part of this program was to teach computer literacy. Many of these healthcare providers were from outlying areas and didn't know how to use the computer, but as we take for granted here, once you have computer literacy, you have the world of information open to you in the palm of your hands. So this has been a critical part of the training that we've provided. The program expanded several years ago, and I'm very happy to report that some of our board members have been to Artsakh and have actually lectured there as part of our program. And instead of just bringing one doctor at a time to Yerevan, we now bring a team of physicians from Yerevan to give lectures, all day, 2-day programs in Artsakh. Given the situation with the war, this program has been expanded and new partners have been brought in as well, including the family of Rafi Hovanessian and Fund for Armenian Relief and possibly the Boston Group. And thus far this year, we've trained 10 physicians in the traditional program in Yerevan, and we have 5 physicians in Artsakh there. 2 of them are going to be there, one, the endocrinologist through September, and another physician who will be there through the end of the year. So these are physicians who are in Martuni, which has identified needs given that the local physician population are now refugees within Armenia. So we're making these changes to the program. So in conclusion, this program is alive and well, impactful, and in the eyes of our founders, it's really helping people and giving them the most up-to-date care, people whom we've never met. But you remember, each healthcare provider we treat sees thousands of patients per year. So the exponential impact of this program has been really terrific. It's been recognized by the Republic of Artsakh and their healthcare ministers as a vital program, and there are ongoing discussions how to improve it further. Thank you very much.
Next, I would like to introduce Dr. Solin Khotaklanyan, who will speak to us about the COVID consulting.
Hi, everyone. I think everybody here pretty much knows what I'm going to talk about because most of you were present for these. But I just want to summarize my effort and AAHPO's efforts about COVID-19. Obviously, this pandemic was a collective ordeal that we all went through together. So I am sorry if you lost anyone dear and near your hearts to this disease. But I am also very happy to see that most of us are here alive and through it, thankfully and hopefully. So when the pandemic first started, as all of you know, I'm a pediatric infectious disease specialist and especially specialized in viruses. And therefore, this was an area of specialty of mine, not the virus itself, but viruses in general. So I thought that the only way I'm going to be able to contribute is by sharing the knowledge that I had, which was obviously brand new and remains a lot to be unknown about this. But I thought that if not now, when can I actually help my Armenian community locally in Armenia, in Lebanon, if I don't contribute what I was learning on a daily basis in my job and in the multiple protocols and guidelines I was doing for my hospital and listening to innumerable lectures and sharing it with the community. So I know knowledge is power, and at that time we were all feeling powerless, except in that regard. So I wanted to make sure that I was able to share that with the community. So obviously we wanted to use all kinds of communication we could to reach as many people as possible. So I started with writing up some alerts, some of our AAHPO alerts, which had probably the highest opening rates during that time because people obviously were thirsty for knowledge, especially in the beginning of the pandemic. So the alerts was also distributed not just to AAHPO members, but we sent them to the dioceses, to the many nonprofit organizations that Larry listed, and we are happy to say that they all found the information very useful. And then, other than the AAHPO alerts, very soon after that, we decided that I think a public forum where people can ask direct questions to me would be a much more effective way of communicating the day-to-day information. So we set up the town halls, which Arthur said it became every other week, but in the beginning of the pandemic, it was every week, every Thursday, where I would share the information that I had gained. We also did a couple of webinars where we opened it up to the public. The town halls were invited attendees, and the webinars were for the public, where again, both during the pandemic and then when the vaccines came in, we wanted to make sure that, again, we shared that information. And after a few months of the pandemic, when I was the main driver, I would say AAHPO was the vehicle and I was the main driver because I happened to be a specialist in that field. But after a few months, especially in the summer when the rates started going down, but we still had a lot of disease and a lot of unanswered questions, we wanted to make sure that we had a lot more community engagement and a lot more public health umbrella as well, not just the clinical aspect of things. So that's when the town halls expanded in a very nice way, where we had different invited guests every week that I'm sure Larry will expand on a little later. And we covered anything and everything from the August 4 explosion in Lebanon and how the medical organizations can help, to the war in Artsakh and to the ongoing pandemic. So of course, in addition to that, me personally, you can imagine, and I did it with pleasure. As I said, I felt like this is a time to serve. And I think we all talked about Rafi Hovhannisyan. I think he was an inspiration to do this. You know, in addition to my job, I never stopped going to work. I spent countless hours answering emails, texts, phone calls, to whoever I could help. And of course, I appreciate those of you who put your trust in me and heard me and listened to me and shared that information. I think when also the schools started opening in the fall, I think Larry wanted me to touch on that as well. You can imagine that in the beginning, after months of shutting down, it was another whole new world that both principals, teachers, and students had to get used to. So that's another forum where I participated in. And I think we did 3 different sessions with the stakeholders and with the parents themselves, where they were also able to ask their questions, and we helped as much as possible. I think I will stop here. I think I summarized everything I was able to contribute. Thank you for the support and the trust, as I said. And I wanted to also say that it was a challenge to explain something very scientific to lay people, because a lot of the attendees of these things are not doctors, like most of us here. So I hope that went through well. In addition, for me, it was very thought-provoking discussions with Dr. Bilezikian and Dr. Antrop, and those of us who were in the thick of it, to have these AAHPO forums as well to discuss what we were learning as doctors. So it was a wonderful experience. Again, thank God all of us are healthy to be on the other side of it. Thank you.
Okay.
And Celine, you need to be complimented.
Go ahead, Larry.
Yeah, you did a wonderful job. And I think what many of us began to realize is that when you hold yourself out to the public through these webinars, people find your phone number, your email, and you get texts and questions 7/24. Very challenging time, in addition to your own needs and your family's needs that you have to address. So thank you for all that you did. Kim, unfortunately, is a family emergency. Celine, would you be able to ad-lib a little bit about the vaccine advisory services you're providing to Armenia, and perhaps a little bit about her public health working group?
Absolutely. So as I said, a few months into the pandemic, we obviously realized that it's not just the clinical aspect that's important, it's how to reach the people. And obviously, as you know, the public health component of it, it was extremely important. And as you guys know, Kim has a public health PhD from Johns Hopkins and is a professor at Columbia and has a lot of contacts in Armenia because she's a lecturer at the American University of Armenia, and she has many students both at Columbia and in Armenia who are studying public health. So it was the perfect, again, vehicle, both AAHPO and her specialty to create a group of both young and more seasoned professionals to be able to navigate both the community here and the community in Armenia, which I'm sure you know was thinking about the virus very differently, was looking at things very differently. At some point, you know, during the war, they completely neglected any sort of COVID-19 public health measures. So she created a second parallel working group, which was called the Public Health Working Group. And because it had a lot of young people in it, I must say they were stronger than AAHPO in reaching people by social media, because the young people are much more savvy with social media than our side, although we now have Eric Francais and many other people who have joined our team, and we are expanding in that forum as well. So she basically, we produced, again, edited by me and with the consultation of clinicians, we produced many social media posts and things to educate the population. In addition, when the vaccine was going to be introduced, as you know, we are lucky in the US that we already had so much supply that it was not an issue. But so it was not just the educational component about the vaccine, but which vaccine to get. And so me and Kim were a part of a consultation advisory committee to the Ministry of Health of Armenia in order to first educate about the vaccine knowledge. We were lucky that we had already started vaccination here, so we already had a little bit of advanced knowledge about that and experience, and guide them through that. So I think that I'm grateful to her to have put me in touch with the people in Armenia, since people here locally know me, but in Armenia they didn't. So it has been a very good collaboration. We have heard that our input was very important to them, and that's again using AAHPO as a vehicle to reach as many people as we can.
And then that brings us back to Larry, who's going to speak to us about the AAHPO COVID response, town halls, and public webinars.
And then I'm going to be quiet for a long time as everybody else speaks. I can't wait to hear what Deborah says, but I just want to mention that it was an overwhelming time when things hit the fan with the war, COVID, and the explosion in Beirut. Overwhelming in the challenge, overwhelming in the degree of public support, overwhelming in the flood of texts, emails, requests for services and goods. And this organization could not have stepped up to the challenge if it weren't for a army of volunteers led by Deborah Furman. So I can't wait to hear what she has to say. Her efforts are not ending. As of today, we just received a special dental x-ray machine worth, when it was new, $70,000. We just got another 200 pounds of medical supplies from the medical center out in Long Island. And we also got another probably 2,000 pounds of PPE that are needed in Armenia. So her efforts are ongoing, and she has just been really tireless and just incredible in everything that she has done for people whom she has never met before. In terms of AAHPO's COVID response, our response really was two-pronged. It was domestic and what we do internationally. And I think one of the most important things we did was disseminate information, at least the best information we knew at the time. As you know, with COVID, every day brought new challenges, new information, new ways of dealing with it. And it was very hard to separate fact from fiction. But we were very grateful to our board, and particularly some members, which I'll mention in a moment, who really helped us filter through this massive amount of information and disseminate it via social media, which we'll hear more about in a report from Judith Lee later today. When things very early on, due to the efforts of Kim and Celine, we were tipped off that this was going to be a very, very challenging time. It wasn't going to be a 2-week shutdown. And very early on, we realized that knowledge is power, as Dr. Kojaglanyan says. And the purpose of the town hall was to bring information, scientific evidence to the leadership, the NGO leadership of our communities, the clergy leadership of our communities, so that they in turn could make the best decisions for the Armenian public. In that vein, we had 33 town halls in 2020. At its peak, it was going on once every week, and they were extraordinarily well attended. Up to 70 leaders attended. These were not open to the public. And the reason for that was we wanted to facilitate a discussion where people can let their hair down and talk about the challenges that they each face and ask questions from the experts. In addition to providing the scientific evidence, we also let and had invited political leadership, NGO leadership, clergy leadership, legal scholars to give their input and their perspectives, how this pandemic was affecting their followers and their organizations. All in all, it was an amazing array of speakers representing all walks of Armenian life throughout the United States. And we also had participants from Armenia, from South America, from Canada, from Europe. So really we had a good grasp of what was happening in the different countries, and as good of a grasp as we could get on the latest treatments and ways to approach this. We also hosted 3 public webinars. One of them received over 10,000 views with a new partnership with the AYF that we had never had before. We were the first area hit, and it was just horrible. Our hotline that we have, which is both an email address, info@aapo.org, as well as a phone number, was really went off the hook. So many people got sick so quickly that bad things happened, things that were unimaginable. There was one patient being discharged that couldn't get oxygen. Pulse oximeters were in short supply. We had people being discharged from the hospital with a discharge plan, but no doctor, no medical follow-up, no visiting nurses, no physicians. They would call their healthcare providers and just get the answering service. So AAHPO created a medical SWAT team consisting of about 10 members who helped these orphan community members. And in some cases provided daily house calls, did internet follow-up, and really helped fill that void that was created by these doctors who were and healthcare providers that were missing in action. When this pandemic happened, it happened like flick of a switch. People were caught in the middle of their travel plans. There were many, many people visiting from Armenia with chronic diseases, such as obstructive pulmonary disease, diabetes, hypertension, sleep apnea, who were caught off guard, and they didn't have the medical supplies and equipment that they needed to remain healthy. We were in daily contact with the Armenian embassy, and due to this incredible team represented here, but others, we were able to overcome international language barriers of what medicines did what, and we were able to provide every single stranded traveler with the medical supplies and equipment they needed. In one case, a doctor drove up from Philadelphia to the George Washington Bridge to bring a sleep apnea machine. It was truly an incredibly busy time. And we met a lot of nice people along the way, a lot of very grateful people. We also had a crisis in the tri-state area of not having enough physicians to meet the demand that COVID was presenting. So there was emergency statutes by both the states of New York and New Jersey to grant temporary emergency licensure to foreign medical graduates. And we did assist several Armenian foreign medical graduates get their emergency licensure status. We also developed a medical supply network, which we heard about, that brought literally tons of equipment to Armenia, and we forged relationships which are still ongoing, as the needs of Armenia will still be ongoing. Having said that, there's a delicate balance between what we need to send at some expense versus what they can purchase in Armenia directly. In that regard, we raised funds, considerable amount of funds, more than we have had previously, from more diverse source of donors than ever before, all along the East Coast. So again, this really transformed our organization in ways that we had not anticipated. Internationally, our alerts that Celine was the author of or co-author of on many of them were translated into Eastern Armenian and distributed throughout Armenia and Artsakh to help inform their public of what was happening with this crisis. We did do that airlift of critically medical needed supplies. We enhanced our CME program, the continuing medical education program, as I spoke of earlier, in order to meet the changing needs of what's going on in Artsakh. And this program continues to be modified and changed as the needs require. Many of the efforts that we did were coordinated with the Ministries of Health and Defense. In previous times, things were very confusing. Any one of us involved in this organization received emails, text messages, calls from different healthcare facilities and providers in these war-torn and COVID-torn stricken areas. And it was really quite confusing as to what the priorities were. Through the Armenian Medical International Committee, of which AAHPO is an active chapter, we created a central data bank for needed medical supplies to help streamline the process. It was not a perfect system, but it was really the first time it was done. And the fact that this was done is to be applauded despite its warts and difficulties in implementing. We also created a central data bank for needed essential medical personnel. So in the middle of COVID, we didn't need trauma surgeons, we needed pulmonologists, we needed cardiologists, we needed infectious disease experts. In the middle of the war, we needed the plastic surgeons, the trauma surgeons, the burn surgeons. And then following the war, we needed rehab specialists, and that's where we are. And hence we're doing the ICPD rehab CME program that will reach somewhere between 600 and 1,000 healthcare providers throughout the world. We also, through one of our members, gave strong support to the burn center in Yerevan, where many of the soldiers unfortunately suffered third-degree burns and worse. As Celine alluded to, our AAHPO Town Hall program was extremely active and a way to share information with so many of our leadership. And we also heard from leaders of other organizations who were very prominent and learned from them. And together we stumbled through this to the point we are now. None of this could have been done without considerable time and effort. And again, I look at my colleagues here. I look at Dr. Hakimian, Dr. Kojaglanyan, and Dr. Bilazikian. These are people with full-time, demanding academic and clinical jobs and responsibilities, involved in spearheading COVID efforts of their respective academic institutions. How they did it, I don't know, but I think our communities are forever grateful for all the time and energies they spent sharing their informed knowledge and judgments with us so we could proceed in a safer way and have a better outcome than otherwise might have been expected. So thank you very much. We also want to thank, again, the alphabet soup of Armenian nonprofits. There was an unprecedented amount of coordination and cooperation amongst all of these organizations. These conversations are continuing to this day and are leading to more collaborations that will be more impactful than what we've done in the past. So again, the motto throughout all of this was that together we'll overcome COVID. And indeed, it looks like we are, but we still have more to go. On that note, I want to thank everybody for all of your efforts, those I mentioned and the many that I may not have mentioned. This really was a total team effort, all hands on deck. And I can't tell you how heartwarming it was to see all the volunteers, people whom I never heard of before, healthcare providers, students, people that were unemployed, picking up the phone and acting as drivers. One person drove all the way up to Connecticut to get about 800 pounds of antibiotics from a hospital up there. Doctors donating things from different hospitals. It was just really an incredible, incredible experience. And for that, I'm forever grateful and extremely humble. Thank you very much.
Next, we have Dr. Joyce Kurdian, who will speak to us about the AAHPO website.
Hi. I'll keep it brief because I know there's a lot of presenters and there's a lot of more content to be discussed. So for the website, everyone knows we've been working. The new website continues to be developed, but it's up and running and there's a lot of content on it. It integrates the information from our old website as well as the website that was started to be developed in Armenia. So it's putting all that information together. The newer content also includes sections on authors and publications and medical research. So that will be growing as well. There's a whole section on COVID with the town halls and the videos. So there'll be a lot of past content as well as future as it goes on. It'll be a good resource as AAHPO continues to grow its audience in the future. So we just want to have more people logging onto the website, and there's going to be more of a connection between the social media, the LinkedIn, Facebook, and Instagram. So we have people working on that, Steve Negoshian and Eric Frances and Judith Lee. So the three of them are trying to coordinate all the social media. So hopefully that'll increase over time. That's it.
Thank you.
A question for Joyce. Joyce, on January 1st, 2020, did we have a functioning website?
No. So all of this also occurred in the middle of the whole pandemic. So we started, I guess it was last summer. So, or in the fall, probably last fall. Actually, yeah, so it got moving pretty quickly, but it's almost done. There's more to edit and more content to add, but it's really well functioning website. It can also accept donations now too, which is nice, which is good. Yeah.
So never let a good pandemic go to waste. Thank you, Joyce, for really seizing the opportunity to bring this project to fruition.
Next, we have Dr. Luisa Kubikian, who's our membership chairman, and she'll speak to us on various issues.
I'm going to keep my presentation brief also. I liked what Joyce, the way that Joyce did it. In any case, as far as the membership, we are inching toward about 70 paid members. We were talking about the idea of presenting, offering more for those who pay their dues as far as showcasing them, their specialty, their some detail about their achievements and their interests in medicine, and also including their offices and telephone numbers and so forth, and limiting the number of professionals who will be on the website as a listing, so that perhaps more people would be interested in becoming members, and this would be offered for free. One thing that I was thinking about was whenever we do these things, that perhaps we should get written permission from the healthcare providers that we can advertise their name. Now, as far as the website and what Joyce has touched on, you know, we have quite a few booklets and lots of photos and so forth. So I know that there are a lot of things to be included in the website, but I would love to see the booklets there, the honorees and their biographies, Also, something new, perhaps have a section on in memoriam for board members who have passed, recognizing their contributions. And also perhaps some of the honorees that unfortunately are not with us anymore. Of course, have a section on COVID and all of the wonderful people who have donated their time and knowledge and recognizing them. I think we have the biographies and photos of the board members the CME, medical mission, and so forth. And of course, the AMIC. So I think that would be my report.
Okay, thank you. Thank you, Louisa.
I also want to thank Louisa. She has an incredibly deep ability to record history. And if it were not for Louisa and her beautiful banquet brochures, we would not, booklets, we would not have the history that we have now. Historical photos, a history of the individuals and the organization. And an organization wouldn't be a robust organization without a good documentation of history. So I think of Louisa as our secret weapon. So thank you very much for all you've done.
Now we can move on to Lynn, who can speak to us about the AAHPO alerts.
Yeah, before I speak about the AAHPO alerts, I'm going to talk about, we did a small fundraiser for the war on Artsakh. Like all the organizations were trying to come up with creative ideas on how to raise money. And Larry, through a connection through his daughter, introduced us to a company that was making candles. So we had a small fundraiser of the Yerevan candle. And to date, we sold 204 candles. And we donated over $6,000 to the war efforts. This included the cost of the candle was $50. If you subtract the cost to us minus the shipping, $6,000 goes a long way in Armenia. So these candles were a great gift. And there are plans for this year to have a different candle, an Artsakh candle, which I'm looking forward to seeing what that one smells like, since this one is so delicious.
Well, since you're the committee, you get to help decide.
Yes. Okay, cool. As far as the medical alerts, every week, AAHPO puts out a quote unquote e-newsletter to our email list. These alerts are a collaboration of a few people with the efforts of Judith Lee, who puts together some information that is put together by what people have sent her, including Debbie Furman, Solene, Larry, sometimes myself, and other members of the committee. And then it's edited and then it's emailed out. And I think we've had a great variety of subjects in our e-newsletters. Sometimes it's just general public knowledge. And of course, during COVID, there was a lot of COVID information in the newsletters. And I'd like to hear about what our numbers are as far as the people on our list and who's been receiving these newsletters.
We have Judith Lee next to speak with us about the social media.
Well, thank you, Lynn, and thank you, everyone, for asking me to come and share some information. First of all, we have a lot of good news about our email program and our Facebook program, which I handle for AAHPO. So first of all, one of the first metrics we look at in email marketing is open rate. And I'll talk about that a little bit later, but our open rate through 2020 was an extraordinary 33%. The industry average, and that is an average for nonprofit organizations, was 22%. and average, the industry average is considered good. So we're 11 points higher than the industry average, and it's 6 percentage points higher than our 2019 open rate. I'll talk about that, the significance, in a couple minutes. In 2020, we sent more emails than we did in 2019. And that was primarily due to the whole COVID emergency. We sent a total of 125,038 emails to our members and the Armenian community. And these were sent in the form of 161 different medical alerts or newsletters. And that's a very robust average of 3 per week. And some experts in the field would say 3 per week, that's too many. But it's only too many if your numbers drop off. In other words, if people aren't looking at it, that tells you your frequency is too much. But our frequency was up, but our numbers were up too. So we can be very proud of our content. One of the reasons why we had an increase in the number of emails sent was because of the introduction of the town hall meeting, which, especially during the height of the COVID crisis, we were having it once a week, and that involved at least one email and a reminder every week. So another important number for us is the size of our email list. We have an active contact list of 3,207 email addresses. That is up from 1,727 in 2019. This number has grown considerably. It could grow more. And the way we grew it in the past year was by actively adding addresses whenever they were available to us. Our AAHPO president is especially good at passing along email addresses, but we would appreciate if any of you are receive a distribution list, receive emails from an organization from the Armenian community, we would add those to our AAHPO alert list. And I want you to know that if anyone doesn't want to receive our emails, they can easily unsubscribe, and we never re-add them to the list once they've unsubscribed. So it's a very ethical system. Okay, and one thing to note is the e-blasts or the newsletters, they don't go to all of our entire list every time. We have a number, like for instance, we had some very specific sub lists that we sent the town hall invitations to. There are some emails that are members only, and there's some then for everyone. So this is key analytics for AAHPO email and our Facebook for 2020. So one of the first questions you might ask is, why do we use email? Many of us feel overwhelmed by email and we say, oh my goodness, I can't look at all of these. I feel that way some days myself. And of course, millions of people use social media, but the beauty of email is everyone does email. Even if they aren't looking at, everybody isn't looking at all of them all the time. Everyone uses email. And email marketing, which is really what we're doing, it lets you control your frequency of sending and your target audience. You can target messages to sub lists. So email is a very powerful tool. And here is a slide, and I'm going to read you the numbers. I'm sure it's a little small for you to read. These are the key analytics that our email service provider, Constant Contact, provides for us. This is our analytics from January 1st, 2020 to December 31st, 2020. And the three metrics they look at are the number of emails you sent, how many were opened, and then who clicks through on any of the read more, learn more clicks, links you put in. So as I mentioned, 125,038 were sent. This was showed a 33% open rate. Very, very good, excellent, and increasing, which is always a good sign. Our opens are 39,330 opens. These are people who opened the email, and we're presuming they read it. 62% were on a desktop, 34% mobile, and a small percentage on a tablet. And then our click-throughs were 2,651. I will tell you that it was a similar proportion as to the open rate, most on the desktop, then on the mobile, and some on tablet. And our clicks just really give us a sense of interest. So that was a healthy rate and increasing. And our email service provider gives us trends. So our open rate was 33% versus the previous year. So it was up 6%. And the industry average, it's up 11%, which is just really, really good. Our click rate was 7%. It was up by 4 percentage points from the previous year, and it was 5 percentage points above the industry average. And once again, our industry is nonprofit organizations. So what affects the open rate? Frequency, how often you send things. Sometimes more frequent is better, sometimes less frequent is better, but frequency does affect it. Interest in the topic. Always the latest news is of great interest. And that's why many times members of the board will send me some of the latest news. We try to get that out. And that was certainly very important during COVID. And membership and nonprofit organizations like AAHPO do generally get a higher open rate than, say, commercial businesses. Because just by nature, the members or the supporters of a nonprofit organization are almost always interested in the topic. So the bottom line is an increasing open rate means you are connecting with your audience. You're connecting with more of them, and you're connecting, you're more interesting to them. So it's a very good thing. Okay, so just quickly, I have a couple more facts to share. This is about Facebook. You might wonder, why do we use Facebook? You might know people who say, I don't like Facebook, I quit Facebook, Facebook is no good. And millions of people use other kinds of social media. But 2 billion people use Facebook, all right? And Facebook offers different demographics than other social media, like Instagram or Twitter or LinkedIn. So you're reaching a somewhat different audience. And Facebook also gives us a really great platform to publicize events. Really good platform for that. Facebook analytics, Facebook gives us these analytics. These are actually not from last year, from 2020. These are recent analytics. They actually don't store our analytics for longer than 90 days. But just to give you an idea of what they tell us, actions on a page, post reach, which means how many people looked at something. So there was something we posted in the last week where we had a 121% increase in the number of people who looked at a post. Post engagement is someone who either liked it, shared it, or commented on it. And in the last week, we had a 275% increase in post engagement. Page views, just people who looked at the page in general, and overall responsiveness. So Facebook gives us good analytics to monitor what's going on. I'll get on to what I consider the most important metric in Facebook followers. We have 962 total page followers. Now, that is up from 748 in 2019. Okay, so we really have increased during 2020, and it continues to increase through 2021. My guess is the news, the same kind of content we publish in our newsletter goes onto Facebook and other things as well. Plus events get publicized. Our frequency of posting to Facebook is up because I have been putting out more newsletters. So I have more content to put on Facebook. And also I often repost what Steve Negocian is posting on other platforms. So that's all for the best. And I would say that it's good to use Facebook to have it, and it's benefiting the organization. You might wonder, how do we increase our followers? How do we get these people to like the page? Once again, it has to do with how often you post, how interested people are in what you post. They're always interested in the latest news. And then because we're a membership nonprofit organization, we do get more engagement than, say, a commercial business who's posting. But once again, increasing followers, Facebook calls them fans, means you are connecting with your audience. I'm going to do a screen share again and just go to, I know you're a little short on time, and I'm going to go through Steve's presentation just to his conclusions. Steve Negocian has been, I think, doing a great job with the LinkedIn, YouTube, and Instagram programs, and has some very good metrics. I'm going to, let's see, I'm just going to look for, see if we have an overall page. All right. Just quickly, LinkedIn has grown. LinkedIn was not opened, and the account wasn't open until July 30th, 2020. But in the second half of the year, it grew 157 followers, and it is has a very good engagement rate in LinkedIn. And one thing that we will ask all AAHPO members and officers to do is, if you're on LinkedIn, to please follow the AAHPO LinkedIn page, like the posts, and tag your friends and colleagues. That will help our LinkedIn effort. YouTube has really just been relaunched since January, but we've made great strides. YouTube is very important because it's actually an important search engine. and we have added a lot of content. We do need more officers and members to go and subscribe to our YouTube page. And that doesn't cost you anything. That's free. But that will help us very much. But Steve has added quite a few videos, and I've worked with and Steve on some videos. So that's been very important. The Instagram program has really grown quickly. It started in August 1st, 2020, and we now have 496 followers. It's a very good growth, and Steve has been very, very good at kind of what we call creating content. It's not always as simple as just posting information. You've got to have an image and make it look right. So we want you to follow the Instagram, like the posts, tag your friends and colleagues. And anybody, I'm sure Steve would be happy to give anyone a tutorial on that. Steve is continuing to add engaging and informative content to all the channels. He does monitor them daily for any comments. And he is really very helpful and has been working strategically to work in tandem with any partner organizations. And I know he often will send me content that needs to go up on Facebook or placed in a newsletter. So overall, I think it's a lot of good news in the social media area.
Looks like Dr. Deborah Furman has been able to join us. Are you there, Deborah?
Thanks. I was unlucky today on call, so have a few. Okay, so I wanted to update everyone for the platelet, supplies, medical supplies. Sorry, my mind's all platelets today. Basically, we have been, the medical supply committee was formed because of the need during the war to collect medicines, equipment, and supplies to send to Armenia during the war effort. And we initially collected via Larry's office, sent to Sado Harutyunyan's warehouse, and transported things to Delaware, and then eventually got things to Armenia. And over 1 ton of medical supplies arrived in Yerevan on Friday, December 11th. Due to governmental bureaucracy disorganization, supplies were cleared on March 4th, 2021, and they arrived at 2 hospitals, the Ardashat Medical Center and Republican Burn Center on March 15th, 2021. We also transported duffel bags with medical supplies via Air Qatar and Aeroflot with 3 passengers. 2 of them were successful. One attempt was a bit unsuccessful, but we're still trying to get the supplies, and they've been confiscated, and they're currently in the Moscow airport. So over the past month, since our last update, the Armenian home in New Jersey had recently closed, and Larry has requested a list of items to be donated by them. And then once they have a list, we're gonna give it to Hampartum, and he'll decide which items should be shipped over and what we should sell and just donate to them. This would be a cost-effective approach. We also have collected some supplies that we will be shipping to Armenia via sea. Stanford Health donated PPE, and on May 6th, the warehouse received 10 pallets of medical supplies, including masks, face shields, and disposable gowns. Dr. Kinoyan is donating a panoramic instrument, X-ray instrument for a dental chair, and Hampartum found a place at Hand in Hand Charitable dental clinic in Artsakh, so that may be a possible place to donate. And Joyce has been helping as a mediary with the donor. Another option is possibly COAF. Also, Dr. Vahed Tateosian has 200 pounds worth of supplies that he's collected that he would like to send to his friend in Armenia, a doctor. And we're just in the process of trying to get them to Larry's office. In May, there was a meeting with the Minister of the Diaspora when he came to visit. And at that time, they discussed many things with regard to the supplies. One of Dr. Barsumyan's partners, Dr. Fuad from Iran, a 200-pound whirlpool was donated, and it's like missing in Armenia, so they were working on that. Dr. Barsumyan was going to send an email to go to the Minister of the Diaspora. And after that meeting, it was requested an informational package for about what we did so far for the confiscated duffel bags at the Moscow airport and what has been done to retrieve them. However, Dr. Barsumyan's really working on it, and he requested that we not send the letter yet. He's been working on getting all the items with the assistance of his lawyer, Antranig, and a mutual friend of the lawyer. Dr. Barsumyan has received 3 letters from the Russian government, all saying the same thing, that they are confiscating the items and that he should go there and be present while they confiscate the items. And the most recent letter stated that the 393 items that were confiscated have now become 225 items. So basically on June 2nd, Dr. Barsumyan sent a letter in Russian extending the power of attorney, and it'll take like 3 weeks to get to Moscow. And then his lawyer will take that letter to the airport, and then we'll see what happens. Other than that, no other updates to report. In the future, you know, if we ship things, we'll likely ship by sea as needed. It's cheaper that way. And when there are specific requests from Armenia, we'll elicit our contacts to help obtain them. And we're in the process of obtaining those 3 confiscated items from the Moscow airport. That's it. Thank you.
Next, we're going to go back to Dr. Joyce Kurjan to speak about the medical mission program.
Again, I'll keep it brief because it's a lot of things on the agenda today. As everyone knows, the formal medical mission group was canceled in 2020 and 2021 due to COVID, obviously. But that being said, several doctors or physicians just went on their own and did volunteer service and work in Armenia, especially right after the war. There are plans starting up again for formal medical missions to resume through AAHPO. In the past, we've worked with COAF as well as FAR using their infrastructure. As a reminder, you know, we've gone to Yerevan, Armavir, Alaverdi, in Lori, Panik, Berd and Tavush were the most recent site that we went to right before the pandemic in 2019. We have a very exciting thing. We're going to be speaking, Dr. Alice Saradarian from COAF reached out to us recently, and they want to meet with some of us and discuss a possible working together collaboration through COAF and AAHPO, a more formal one, because I know we've gone and worked with them using their clinics in the past, but it seems like their clinics have expanded and they need, they would like to have us collaborate and work with them more closely. So we are going to have a conversation pretty soon. I think it's in the next couple of weeks. So that should be exciting, and we'll see what comes out of that discussion. So that's it.
Next, we have Dr. Kanani Khachadurian to speak with us about the medical workshop program.
As you know, the medical workshop took a vacation during the year of pandemic. because the pandemic took over for the teaching of COVID, and we took a break. The medical workshop actually started several years ago, and we were very happy to have our medical experts to inform, educate, and update the Armenian community about current health issues at several Armenian churches. Last May, due to COVID, as I told you, we had to cancel our workshop at St. Leon Church, which was about the rise of addiction, and especially opioid and other addictions during the pandemic. However, instead of the medical workshops, I told you that the workshops were taken over by Larry's town halls for information about COVID-19. We had a request from St. Leon Parish Council Chair if we will please resume our medical workshops, which they had greatly appreciated. And yes, the answer was yes, and the president approved that we continue the medical workshops. Thank you for listening.
I'd like to give a shout out to both Dr. Kachadurian and Dr. Maljan. And this was not on the agenda, but if we have a moment at the end, I think we all would like to hear what the first board meeting was like when AAHPO was started 26 years ago. Dr. Kachadurian is the only board member in AAHPO history to be a member of every AAHPO board. So thank you very much for your continued involvement.
Okay.
Okay.
Thank you,
Welcome.
Gennady. Dr. Tro Kalajian to speak to us about the AAHPO Welcome Back Walk.
Hi, everybody. Nice to meet you. My name is Tro Kalajian. I am a new member here, now 2 years. I'm certified in internal and obesity medicine. I practice in New York, in Tapan, in Rockland County. Before I talk about the walk, I just want to thank a couple of people close to AAHPO, including Hampatsum and Dr. Kevork Yahyayan, who was instrumental in working with me and Butterfly, the company that makes point-of-care ultrasounds. We were able to get 2 ultrasounds to Artsakh in a week's notice. My father took it actually himself and delivered it. We had a sister group in Massachusetts that I believe donated 10 point-of-care ultrasounds. And we were able to do an emergency ultrasound course that I helped organize with premier members from the world, Dr. Rachel Liu and Dr. Jeremiah Tyson, to teach about 50 Artsakh healthcare workers how to use, point-of-care emergency ultrasound. So I just wanted to thank AAHPO and Hampatsum and Dr. Kevork Yahyayan and Larry for being instrumental in organizing that all. With regards to the walk, as many of you, just like you, I've been dealing with COVID, both inpatient and outpatient. And as the COVID cases come to a close and hopefully vaccination rates increase and we achieve some herd immunity, we can now regain our attention on other public health measures like basically the physical inactivity and the worsening obesity epidemics that we've seen in response to some of these, to the side effect of these public health measures. Every 1 month of lockdown has resulted in on average 1.5 pounds of weight gain. And this is just ravaging our communities. We're seeing worsening diabetes, sarcopenia. And so our efforts are going to quickly shift from an infectious disease and public health focus to how do we re-engage this community to get out and to walk and to get physically active and to start thinking about both their mental and physical health. So this is the nature of the AAHPO welcome back walk. It's hopefully there won't be a third or fourth wave, and this we can say bye-bye to COVID, and now we can get back to focusing on the diets of our patients, the physical activity, and just re-emerging AAHPO, I guess, and to the community and getting them active. So on September 25th at Van Son Park, we're holding a community event, which will just be a simple walk, and we're hoping that every clinician that's on this phone call right now will work to actually get their whole offices there. We're going to have a little competition which office can have the most members from their office and patients and community members complete the walk, and maybe there'll be a special prize for the office that gets the most people to complete a walk. So this will be on September 25th, and please look out for more updates from that on those social media and email campaigns that Judith talked about. I'll stop here, and I don't know if there's any questions. And just as a point of clarification, this is separate from the 5K walk. We want it to be very distinguished from that.
Dr. Lucy Tovmasyan to speak to us about the 5K program.
Hi, everybody. So the 5K will be held as it traditionally has in the spring, but our idea that's going to make this year a little bit different than previous years is that we're going to use this welcome back walk kind of as a springboard to get people back into shape and back into the habit of exercising. And so what we plan on doing is having some lectures from between the initial welcome back walk that involve people discussing nutrition, exercise, and how to get back into shape, so that when the 5K does roll around, we will hopefully have not just a larger turnout, but we can actually see an improvement in people's health as they emerge from the lockdowns and from all the let's say like lack of exercise in the past year and a half or so. So the 5K itself will be as it traditionally has been, which is an event where we get people together, we race, and then we have some time afterwards for refreshment, snacks, and all of that. But what we want to improve on this particular year is the lead up to it and add more of an educational program that goes along with it, just so we can get our members back into shape and into the swing of things.
Next, we have Dr. Gadri Spaidar, who'll talk to us about the mentoring program.
Mentoring program, we had a very successful program just recently, and it was all Zoom. It was a Zoom meeting. It was all virtual, and it was, very successful. And it's evolving to a new and large mentoring group. It's a collaboration of 10 Armenian organizations now. And there are new and exciting plans I want to tell you about. We want to have 2 meetings, not just one. One in person. It's planned to be held in September, sometimes mid-September, and hopefully inform them if it's available. If it's not available, the other options are the diocese or AAHPO headquarters, maybe a location to be considered. And the other virtual meeting is going to be held in late winter, early spring. It's a good plan. We're going to have a rooftop cocktail reception in July 21st. That's to attract young people. And there are some exciting ideas about helping students, about helping them with their resume writing skills. And we want to help them with that. And there's also a plan to have a virtual speaker to help again students about finding their
career choice, correct career choice. So a lot is happening with mentoring program. We started this like 11 years ago. It was just 20 people. Now it grew to 10 Armenian organizations and a lot of students and a lot of actually more, still more mentors than mentees. We need more mentees. That's how I feel. Any questions about the mentoring program?
Questions for Garbis about mentoring?
Larry, do you have anything to add? Because you are very involved with that too program.
No, I have to say that I admire your initiative. The organization is only as strong as its members. Honestly, you mentioned this to the board as an idea. You were a founding partner with AESA, the only two organizations to start with it. You've had a sustained interest and participation and have overseen this growth to where it's becoming a spin-off into its own right, serving our community in new and exciting ways that we could not have imagined. So I applaud your sustained initiative and work that went into seeing it to this point. And it's so nice to see other board members following in your example. And that's what's going to make this organization very strong as the years go on. Thank you very much.
Next, we have Dr. Lena Mirjanyan, who will also speak to us about the Mentoring Forum and Advisory Program.
Hi, everybody. Yeah, so I think Dr. Badar actually and Dr. Najarian just covered a lot of what's been going on with the mentoring in this past year or so. But I think, like you guys had mentioned, I think the virtual platform, I think, is really a unique way for us to be able to reach out to not only the different Armenian organizations, but across the country and in Armenia as well. And so I think to have both the in-person and virtual opportunities, I think is going to be, it's going to work well for us in the future. In this past year, we actually had a couple of applicants who had contacted various members in AAHPO. And I think with the help of those individuals, these students were able to get spots in programs that they're looking for in residency as well. And yeah, as the other programs within the subgroup that we have with the different organizations, as we come up with the different events that Dr. Badar mentioned between the event in July and some of the other events coming up, we will communicate that with our members.
Okay, thank you. Thank you, Lena. And now we'll get back to Dr. Garbis Badar, the treasurer, to discuss the treasurer's report.
We don't have much, unfortunately. We started, actually, we spent about close to double the amount we brought in revenues. We started the year with 76,600 and change, and we ended the year with 35,600 and change. So we had revenues 48,782, membership 6,800, donations 35,000, professional meetings. I have to remind you, we didn't have too many professional meetings because of COVID, 6,680. Our large expenses are, the main one is the Karabakh mission, or the Artsakh mission, the CME program. We contribute $25,000 every year. And the other large expense this year was the war efforts. Our support to Karabakh cost us over $20,000. But I have to remind you, a lot of it was donations, and we also had the Rafi Barsumian, who did a lot of work in Armenia. He was given big checks. He just, because of tax reasons, he made us don't put the money in our account because we are a 503c organization, and we paid him. So that's why our expenses look like quite a bit, like 26,000 in healthcare war efforts. But I am optimistic that we have now COVID is hopefully over, hopefully. And we have CME program, support coming. We have candles, and we're going to bring us $6,000. That money is not in our account yet. And we also have in the fall, we are planning a banquet, hopefully in person, not Zoom banquet, where we can raise some money. So I'm optimistic.
Very good. Thank you. Thank you.
Any
Dr.
questions about the treasurer's report?
Do we have any questions for Garbis?
Could you mention, and maybe Talene can help you, revenue sources that we have?
Revenue sources, we did get donations. We have a program where some people are signed up. I know I am signed up. Where it's a roundup program, credit cards, whatever you pay, it gets round up to a round number. And I mean, I get deducted about $10, $20 every month. And I don't know how many people are involved in that. Maybe Talene knows. We have had some major donations, and I'm seeing names I have never seen before who donate from us, and not only from New Jersey and tri-state area, Armenians from all over the place, even some non-Armenians donating to us. So we did have donations last year in 2020 in the amount of $35,300. So that's encouraging.
So to summarize, if I can jump in, our sources of revenue are dues, donations, Roundup, Amazon Prime, candle sales, the CME event in November, the walk in September, and events that will be scheduled that aren't discussed as yet. But basically, we use 2020 to consolidate efforts and really set up infrastructure. And now it's all about implementation of that infrastructure on the financial side, as well as on the social media side. So I agree with Dr. Garbis's, Bedar's enthusiasm. I think the future is really bright on the fundraising side now that we have the elements in place.
Next on the agenda, we have Dr. Adam Kazazian, who would like to make a few remarks, some observations.
Although I don't have any special report to give, but I'm very, very happy and very proud of being member of the AAHPO. And I like to add to everybody's happiness in the sense that AAHPO, it becomes and it's becoming more and more relevant to our Armenian community. And I'd like to congratulate every one of you who gave us good reports. It shows that we're working hard and we can work better. But I'd like to congratulate Larry for his programs and initiatives and all those things that he does. Also, Judith, working very hard with emails, and what should I say, Talene? Thank you very much, Talene, for keeping us in shape, so to speak. And Peter, it's very nice to see you at these meetings here. For a long time, I haven't seen you, but it's a pleasure to see you back. And of course, congratulations to all our members and workers and helpers. And God bless us, so to speak. Thank you.
I think this meeting was very valuable. Some of us may think, oh, it's just a prolonged board meeting. We didn't have discussions like we have at board meetings, and I always look forward to the board meetings. They're kind of meandering. We kind of get lost in the forest, but in order to get to the goal, I think we have to get lost a little bit and explore ideas, which is really our trademark. And that's why our programs are so robust and strong, because we do give considerable thought to these and, when applicable, evidence-based data. So again, I want to thank all of you for your presentations and for all of your involvement. From my vantage point, we've never been stronger. Just seeing the depth and breadth of all the activities and also all the people that gave reports today. There was a time when Garbis and I and Pierre and Kanadig sat in a room, and it was just the 4 or 5 of us, and many people didn't show up, and there was really nothing to discuss, and we were talking about stopping AAHPO. But here we are, and look what we have. None of us, I don't think, really have grasped the entire scope of what we do, and I think this meeting was very important in conveying the broad scope of activities from education to clinical applications and so forth. So this is a very critically important meeting, again, to acquaint everybody with everything that we do and to look for ways that we can get more involved individually. 2020, there was 2 ways to respond to this pandemic, and one was to shrink up into your room and do nothing and gain 1.5 pounds a month. And the other was to get busy and do something. And this organization, as many other organizations, were truly tested in 2020. I think we passed that test beyond anyone's expectations. When this started with considerable reading, there was a lot of talk of nonprofits in America shrinking considerably and going bankrupt. Well, we're living proof that just the opposite. We're thriving by all of our metrics in all the different areas. And our bank account will reflect that also shortly. So I think we have demonstrated our resourcefulness, we've demonstrated our grit and our resilience to really make lemonade out of lemons. So what did we accomplish? We really transformed this organization in 2020. When we started 2020, we didn't have a website. We didn't have the degree of involvement we have now. We didn't have international recognition that we have now. We didn't have community recognition that we have now, local community. We didn't have a really good social media presence. We now have all those tools in place. We spent a lot of money, time, and energy on infrastructure. That infrastructure is now there. And the challenge for us is to learn how to make this a cohesive symphony and have all the elements work together. So we will have that big band sound and really help this organization grow over the next decade. But we have all the elements in place. We have new programs in place. We've expanded our mentoring. So I'm really very, very excited. I think the infrastructural changes really should drive and attract new membership. We should see an uptick in donations and, again, an increase in our educational and mentoring capabilities. And none of this could have been accomplished without a tremendous team effort, really. It's really been awe-inspiring to work with each and every one of you. I sometimes ask, how did I get into this position? Just because I asked for a tax ID number when the organization was floundering. I think Zoom really helped us strengthen our existing personal relationships with the NGO leadership throughout the world, and also introduce us to individuals that we heretofore never knew, and creating opportunities for new collaborations. So as president of this organization, it's really very humbling to work with all of you that have so much talent. And the team effort, time and time again, has proven that its tireless efforts can really exponentially impact the healthcare of our communities, both here and in Armenia. In terms of how else we do this, we're very grateful to have. So we have to over-deliver to our donors and to our collaborating organizations with whom we could not implement the vision of our founders. What always is scary to me is the end of the year, because the end of the year, on the one hand, is thrilling to see what we accomplished, but the beginning of the year is a blank slate. It's terrifying to see a blank piece of paper and say, what are we going to do this year? But year in and year out, we've somehow managed to fill the slate with new programming and embellished on the program that's already in place. It's really been amazing. It's it's really a testament to what we do, that we've been appreciated by our community now for 26 years. So as this meeting comes to a close, really reminded a quote attributed to Robert F. Kennedy: "If not us, who? If not now, when?" And let's continue our journey. Let's be forever vigilant for opportunities to serve our communities, especially in times of need like what we've just been through. So again, I want to thank you, and I'm very humbled by the privilege to work with all of you.